Hello, my name is Greta. I'm a resident in the cardiology department of the Kantonsspital St. Gallen, and I would like to present you this case of a cardiac tamponade in a 22-year-old woman. And I also want to thank our colleagues of the intensive care unit who took the main part of the treatment in this patient. The woman presented herself after syncope in her parents' home. She was traveling through India about 10 months and back at home about 3 months. She was tachypneic and tachycardic. An X-ray performed showed a bilateral pleural effusion and a cardiomegaly, and a sonography showed a pericardial effusion and an ascites. So there was an unclear polysericitis. She needed to be resuscitated, transferring her to a stretcher. She became asystole, and an emergency pericardiocentesis was performed. Received about 100 milliliter of a brown fluid. ROS occurred about 7 minutes in CPR and with about 5 milligram of adrenaline, and she was transferred to our hospital. In our emergency room, the patient was in an ongoing cardiogenic shock, needed a massive adrenergic support. Due to this, we performed another echo. We saw an pleural effusion and pericardial effusion. There was no signs of another pericardial tamponade, and there were unclear structures on the pericard. The patients needed to have an ECMO installed. After the ECMO and stabilizing the patient, we could perform a CT of the thorax, neurocranium, and abdomen. We saw the known polysericitis as also a big liver abscess in the left liver lobe. With the history of a 10 months travel to India, there was a suspicion of amoebiasis going on. In the next days, we've performed many echoes, and there was a dynamic of the pericardial effusion. During a puncture of the big liver abscess, ultrasound contrast was injected in the liver abscess and filled up the pericardial space, and was so unmasking the fistula between the liver abscess and the pericardium. A few days afterwards, the MR of the heart was performed. You can see the fistula from the liver abscess going into the pericard. There was no myocardial involvement, and the masses on the echo were just softened pericardial fat. Thank you very much for your attention. Goodbye.